Hello and welcome back to GP Video Podcast by Nadia. So today I am going to talk about colorectal cancer once again. Yesterday I picked up the topic, but I just realized that my knowledge is also lacking a bit about the screening program. So I went back to the National Bowel Cancer Screening Program of Australia and have just got updated information for you that I will be sharing with you today. So, bowel cancer, also known as colorectal cancer, is the second biggest cause of cancer death in Australia, while it is the fourth most commonly diagnosed cancer in Australia. So that there is a difference. It is the fourth most commonly diagnosed cancer, while it is the second biggest cause of cancer death in Australia. It is also known as colorectal cancer. And if you remember from yesterday, I actually explained the alimentary tract, mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, anus. And what is the cancer that we are talking about? We are talking about the cancer of large intestine, which is also known as colon. Okay, so bowel cancer, also known as colorectal cancer, develops from the inner lining of the bowel and is usually preceded by growths called polyps, which may become invasive cancer if undetected. Depending on where the cancer begins, bowel cancer may be called colon or rectal cancer. So again, as I said, that after large intestine, the last part of the alimentary tract is rectum and then the anal opening. So if it starts in the rectum, it is called rectal cancer, or if it starts in the colon, it is called colon cancer. So it is the second biggest cause of cancer death in Australia. We have an increased risk of bowel cancer as we age. It can develop without any family history and show no signs or symptoms. It can happen in any part of the large bowel or rectum, parts of the lower digestive system, as I've already explained. Bowel cancer cells can start growing from the inner lining of the bowel or from small growths on the bowel wall called adenomas or polyps. If it is not found, bowel cancer can spread into the wall of the bowel, lymph nodes, and then to the other organs. If it is not found means if it is not detected early. If found early, 90% of bowel cancers can be successfully treated. Don't delay, do your bowel cancer test today. So, if found early, 90% of bowel cancers can be treated successfully. So, we also said that around 16,000 people were diagnosed with bowel cancer in 2024. The average age at diagnosis is 69 years old. As I said, bowel cancer is the fourth most commonly diagnosed cancer in Australia, and it is estimated that 1 in 20 people will be diagnosed by the time they reach 85. About 90% of bowel cancers are adenocarcinomas, which start in the glandular tissue lining the bowel. Other less common types of cancer can also affect the bowel, including lymphomas and neuroendocrine tumors, but they are very less in number, and we do not actually regard them as actual pure colorectal cancers. Cancer can also start in the small intestine or small bowel, but this is a rare cancer. Now, let's talk about the National Bowel Cancer Screening Program, okay? So, people aged 50 to 74 are sent a bowel screening test every 2 years as part of the National Bowel Cancer Screening Program. From 1st of July 2024, which is just 6 months ago, people aged 45 to 49 who are completely asymptomatic and are at average risk can also request a free screening kit to be mailed to them. Okay, now again, before I go properly on the screening program, I would like to tell you that what could be the symptoms of large bowel cancer. So, now here the difference comes. Screening program is for asymptomatic people who do not have symptoms of large bowel cancer. People who are symptomatic should actually go and see their GP and get the investigations started. So, of course, the first investigation is fecal occult blood test, in which the blood is tested in the fecal sample or stool sample. Then, if needed, it will be proceeded to CT or colonoscopy. Okay, so Now, for symptomatic individuals, what are the symptoms? The symptoms are change in bowel habit, including diarrhea alternating with constipation, or the feeling of incomplete emptying. Now, as you know from my different video podcasts, that this altered bowel habits can be a sign of many diseases, including irritable bowel syndrome and irritable bowel disease. But the most sinistrous cause of altered bowel habits is colon cancer, so we should always keep that in mind. Number two, a change in the appearance or consistency of bowel movements, such as thin bowel stools. Blood in the stools, again, blood in the stools should not be a sign of, is not a sign of irritable bowel syndrome and should not be taken lightly until and unless it's like a bacterial dysentery or something, but we should always get tested. Abdominal pain, bloating or cramping, anal or rectal pain, a lump in the anus or rectum, weight loss, unexplained fatigue, iron deficiency anemia, tiredness and or anemia, pale complexion, weakness and breathlessness, blood in the urine or passing urine frequently or during the night, change in urine color, dark, rusty or brown. Though I know I'm talking about urine here and not stool, but any changes in the urine should also be regarded very, very important. So these are now symptomatic individuals. So a screening program is not for symptomatic individuals, because symptomatic individuals who have these symptoms, 1 or 2 or 3 or many, they should go for proper investigation. They would have blood tests, they would have fecal occult blood tests, they would have CT scan, they would have colonoscopy, depending on the extent of their symptoms and depending on the decision of the GP and further referral to the specialist. Now, when we talk about the screening program, please make sure that you have this concept very, very clear, that screening program is for asymptomatic individuals. Now, asymptomatic individuals are then categorized into average risk, moderate risk, and high risk. And how are we going to go? What ages are we going to go? How do we categorize them into average risk, moderate risk, and high risk? We'll talk about that tomorrow. Thank you so much.